KCOG, Karnataka College of ONG, Dr. Muralidhar Pai, who has so graciously joined us from Cloud 9 because he is flying from Bagdogra to Siliguri or some place high up in the mountains. So before we lose the connection, we want him to just give one message to the audience here. There, even as recently as the last 24 hours, there was a section of the faculty from the diabetologist group said that if you test each and every pregnant woman, that is universal testing, you are going to pick up a whole lot of them whom you're going to label as GDM and provoke a lot of anxiety. So Dr. Pai, should we go back to selective tests or the guidelines which we have so emphatically instilled into the government recommendation, the universal testing of each and every pregnant woman in our country? Why should we be doing that? Murali.
Thank you, Dr. Hema, for this wonderful initiative that you are actually continuing, which was started by the great one and only Professor Sheshaya. Yes, your question is very pertinent. What I would like to highlight is that the principle of screening is very clear. If a disease is highly prevalent, then there is absolutely no need to do screening. You can straight away do the diagnostic test. If a disease is very rare, then it's a waste of time and money. If the disease is moderately prevalent, it is moderate risk disease, then universal screening is a must. And we all know that India is a moderately risk country for diabetes in general, as well as GDM. That's exactly why it is absolutely requirement and it is in place that we do universal screening of all pregnant women. And now that we have a very simple test, it should not be difficult at all. It is in line with the principles of screening test as well. That's all I would like to say.
Thank you, Murali. This is a clear message once again to many in our own country, the frontline healthcare providers and the OBGYNs who have not yet taken up to the universal testing. Please, every single pregnant woman has to be tested. And can I just follow up with one question to Murali? What is your message to all the women out there in this great country?
Yes, I request all women that in the interest of yourself, in the interest of the baby that is going to be born, a strict control of sugars during pregnancy, especially in the first trimester, is paramount. We can't overemphasize that. So before you think of pregnancy, in fact, your sugar should be under control. To be precise, the glyco-HB or HbA1c, what we call, should be less than 5.9, so that the babies will not have anomalies. So please, and go ahead and do at least once the test. Insist on your doctor that whether the doctor has prescribed the testing or not. And please remember the word DIPSI. It's a very easy terminology. You educate your neighbors, your friends, and insist that they ask their doctors to do this test. Thank you very much.
Thank you, Murali.